There's this idea that as we get older, some parts of our lives just, well, they fade away. Today, we're going to talk about one of the most important and maybe one of the most misunderstood, our intimate lives. It's a question a lot of us might ask, maybe even just to ourselves. Does our sex life really have an expiration date? Is a fulfilling, close, intimate life just for the young? I mean, it's kind of drilled into us by society, right? This idea that after a certain age of that chapter of your life just closes. It becomes this thing we just don't talk about. But what if that whole story is just wrong? Because when you actually dig into the science, a totally different picture comes into view, a much more hopeful one. The research shows that for so many people, intimacy doesn't just stick around. It can actually get better. So let's get into it. Why does this even matter? Why is keeping that sense of intimacy so important for our health and our happiness as we get older? Well, it turns out it's about so much more than just physical pleasure. People over 65 who report being more sexually satisfied also report better well-being across the board. They feel more satisfied with their lives in general, they have better emotional health, and they even have a stronger sense of aging successfully. It's all connected. And that's really the key takeaway here. Our sexual health isn't some separate, isolated thing. Nope. It's deeply woven into our mental, our emotional, and our social health. It's all about connection and feeling vital and, feeling truly alive. Okay, but let's be real, it's not always a walk in the park. So what does the research say are the biggest roadblocks, the main challenges to staying satisfied later in life? Let's take a look. And the insights we're about to talk about, they come from a huge study. We're talking about thousands of people who were followed for years and years. So this isn't just a quick snapshot, it's a really deep look into real people's lives, which makes what they found so powerful. So they identified 3 big factors that were tied to lower sexual satisfaction. Number 1, poor physical health. Number 2, depression. And number 3, loneliness. And that kind of makes sense, right? When your body isn't feeling great or your mind is struggling, intimacy can be a real challenge. But out of all of those, one thing really stood out: loneliness. It was one of the absolute strongest predictors of being less satisfied. It's this powerful reminder that intimacy, at its core, is about feeling close to someone. And when you feel isolated, that connection is just incredibly hard to find. Now, beyond these general hurdles, the research also picked up on something else, a pretty significant gap in how satisfied men and women reported being. So what's going on there? Well, there are a few potential reasons, and a lot of them are physical. You've got hormonal changes after menopause that can cause discomfort or lower libido. And then there are just the natural body changes that come with age, which can sometimes knock your confidence. But, and this is so important, the good news is that these are not dead ends, not at all. These are challenges for sure, but they're challenges that can be addressed. There are so many ways to find comfort and desire again, from talking to a doctor to just having open conversations with your partner. Okay, so we know the hurdles, and we know they can be overcome, but the study also found something even more interesting. The single biggest thing that predicted higher satisfaction for everybody. So what was it? What was the secret sauce? Was it being in perfect physical shape or having been married for 50 years? Nope. The answer was actually much, much simpler, and it's something every single one of us can control. It all came down to a mindset. The people who were the most satisfied were the ones who actively believed that intimacy was an important, vital part of life, something worth protecting and nurturing. That's it. It's the simple, proactive choice to value it, to talk about it, and to find ways to keep that spark of connection alive. So how do we do that? How do we take all these insights and turn them into a real, practical plan for a fulfilling intimate life, no matter how old we are? Well, here's a blueprint that really connects all the dots. First, invest in your health, both physical and mental. That's the foundation for everything. Second, really put effort into your relationships, your friendships, your social circles. Build that defense against loneliness. And third, communicate. You have to communicate openly. Make connection and closeness a priority, something you choose to work on every single day. Because at the end of the day, a fulfilling sex life really doesn't have an expiration date, it just changes. As we get older, maybe the definition of satisfaction shifts a bit. Maybe it becomes less about performance and more about what truly matters: our health, our emotional closeness, and that deep connection with another person. And honestly, that's a beautiful goal to have at any stage of life.